Hello, my name is Dr. Phil Boyle, and I would like to teach you how to take a Hcg injection with Gonasi. So I will point this out to you, and hopefully it'll make sense. So the Gonasi comes in a package like this. It looks a little, and there's the syringe and the needle inside. So just till I open it out, here we go. We have our syringe with our 1 ml of solution. It's sodium chloride. And what we do is we open it out, pull the cap off, and we start with our large green mixing needle. You just open the end out, connect it to your syringe, and then we're ready to go. Now we want to mix this with the powder. And if you open it out, you will see that the powder, it can look like a tablet inside. So that's your dried powder inside. It looks like a tablet in there. And you have a lid on it. So you simply flip the lid off. It'll come off in a second. There you go. And there's a rubber top on it. You get your needle and you inject the needle and put all the liquid into your powder. So simply pull the top off, find where that is, and inject straight on top of the tablety powder. Now it dissolves practically straight away on contact, and once it's nicely dissolved, you'll find that the needle pulls itself up on its own because there's some pressure inside, and you can finish the job just by pulling up on the rest of it, and there it is. The bottle is entirely empty. All the powder is dissolved and the mixture is in the syringe. If you look at the syringe, you'll see it's marked and it goes up to 1 ml. And what we do is eliminate the excess down to the 1 ml mark. Now we have 5,000 units in 1 ml because there's 5,000 units in your powder mixed with 1 ml of liquid. This is where we have to be careful. And this big needle, don't worry, it goes nowhere near you. This big needle is just for mixing. So we're going to put the tiny needle on in a moment. But just before we change needles, we have to decide, well, what dose are you on? If you're on 5,000 units in 1 ml, fine, change your needle. But very commonly, we give a Hcg 10,000 trigger dose. This is the day before ovulation or peak day. And in that case, you mix this syringe with another powder. So you'd have 2 powder mixed with 1 ml of liquid. And then you change your needle and inject. We very commonly give additional Hcg injections in the second half of the cycle. So when I'm giving additional Hcg, I expel the excess. And the commonest dose I give in the second half of the cycle, we give 3 injections of 0.5 ml. So in order to do that, I've got 5,000 units in 1 ml. If I want to give a half ml shot, then I just get rid of the excess. And just to keep things tidy, I usually put it back in the syringe. So we eliminate all the air and bubbles. If you keep it upright, your air and bubbles are eliminated. And we put it down to the 0.5 ml mark. So we can find it just there, 0.5 ml, perfect. And now, half a ml shot on peak +3, peak +5, peak +7. Tiny micro air bubbles, you don't need to worry about those. Now, before we actually change it around, you cover the needle over, and the best thing so you don't stick yourself is put the cap down, scoop it up like that, and then click it on. And then before you change over, twist off the entire thing and the whole needle comes off, and you put on the tiny little gray needle to inject. So you just take the cap off that. This one's a little stiff, there you go. And then when you connect that on, you just pull the cap off. So this is our half ml shot. And in order to do this, I have our model belly button. So there's your belly button, and about 3 centimeters away from the belly button, where there's a bit of fat under the tummy, you find that area, and you see that's a nice fat area. There's no blood vessels going through it. And you just put the needle straight in, and you hardly even feel it. You just go straight in like that. And once it's inserted, inject slowly, slowly, slowly over about 20 seconds. And after everything is injected, you just take your time. 20 seconds is a long time when you're injecting, so go slow. There's no rush on you. Finally, after 20 seconds, everything's injected. Finger over the point, withdraw the needle and press firmly over the area. if you keep that firm pressure on top of it, then you won't get any bruising afterwards. A lot of people complain of bruising after injecting. The anti-bruising technique is simple pressure for 1 to 2 minutes after injecting. Press, 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 and you'll find there won't even be a bruise or a mark there at all. So a few little extra tips. If you find that it stings a lot, then make sure that you put a dry needle in, because once you change your needle, don't squirt anything else out or the needle gets wet and it can sting. Another trick is make sure that you go deep. So if you go too superficial, it tends to sting more. So it's like grasping a nettle. Go deep. And if you go deep and inject slowly, then you should find it won't sting much at all. Final thing to note is that HCG can give you a false positive pregnancy test and a false positive ovulation test. So doing ovulation predictor tests or pregnancy tests anywhere within 10 days of this injection just isn't a great idea. So the final thing is dispose of your sharps thoughtfully. So you got your sharp needles here, they're covered. These needles, whoever does your monthly blood test, put them aside in a jam jar or something safe. Everything else goes in the normal bin, except your needles. Bring them with you when you're getting your monthly blood test, and the needles can be disposed of in a sensible way. Okay, thank you for listening.